So I am Dr. Satnam Singh Chhabra, Head of the Department of Neurosurgery, Sir Ganga Hospital. Today we are going to talk about the brain tumors, its symptoms, causes, and how to investigate and treat brain tumors. So brain tumors can happen at any age, generally more common in elderly people, but in children also it can happen. Headache, seizures, like which we call epileptic fits also. There may be vision problem, there may be paralysis of arms and legs, one side, both side. There may be speech problem, memory lapses, there may be incontinence. So there can be many symptoms. And one particular type of tumor can also produce multiple symptoms. So now the brain tumors can be, they can originally arise from the brain itself, or they can come from outside. The tumors which arise within the brain, we call them primary brain tumors. And tumors which come from rest of the body and then they come to brain, they are known as metastatic brain tumors. Metastatic brain tumors are usually cancerous. Because of cancer only they spread from the rest of the body to the brain. But primary brain tumors can be benign or malignant. Malignant means cancerous tumors. So benign and malignant tumors can occur anywhere in the brain, several parts of the brain. And the outcome will depend on the type of tumor, whether this is benign or a malignant tumor. And treatment will also vary according to that. And symptoms can be same in both type of tumors, but further treatment will depend upon whether tumor is benign or malignant. Coming on to how to investigate. So the most common investigation these days is MRI of the brain, MRI or the CT scan of the brain, and that tells us whether there is some tumor. MRI is more, it gives us a lot more information than CT scan, but sometimes these are complementary tests. Both may be required. And further investigation may be required like PET scan or other ancillary like hearing test, vision test. All those tests may be needed to see what is the effect of tumor on various functions of the brain. So once it is diagnosed that patient has got a brain tumor, depending upon the symptoms and investigations, then further treatment is planned. Whether surgery is required or not, that is decided. Whether observation is possible, or sometimes some medical treatment is possible, because certain brain tumor there may be medical treatment like a prolactin secreting pituitary tumor responds very well to medical treatment. Surgery may not be needed. And then what kind of surgery, it depends again on where the location of the tumor in the brain, whether it is on the surface or in the deeper part of the brain, or which area of the brain it is located. Whether we decide whether it is deep-seated or maybe simple biopsy is required. Sometimes we do a stereotactic biopsy, a needle biopsy is done if the tumor is located deeper part of the brain and we are suspecting that it is difficult to remove it completely. Stereotactic biopsy maybe. Otherwise, mostly we try to remove the tumor depending upon the location and site of the tumor. The aim is to remove it completely or as much as possible. And after removal of the tumor, then this tumor is sent for histopathological examination, and which tells us whether this is a benign tumor or a cancerous tumor. Benign tumor, if removed completely, then no more treatment is required. Simple follow-up is done in a follow-up MRI scans or CT scans, and to see whether there is any regrowth happening or not. And if some recurrence is seen in due course of time, then further treatment in the form of radiosurgery, gamma knife may be needed. Or if we see the tumor has not been removed completely because of its location close to vital area of the brain or some other structures where it was dangerous to remove it completely, then some part of benign tumor may be left behind, and further it may be treated by a gamma knife or saber knife treatment. And now if the tumor histopathology shows that this is a malignant tumor or a cancerous tumor, then patient is further subjected to radiation therapy or chemotherapy as decided by the team of medical and radiation oncologists, and further treatment is given accordingly. Malignant tumors are also various types, And malignant tumor, it may not be possible to remove completely because they are infiltrating tumors into the brain. So they can come back depending upon the grade of the tumor. So further close follow-up is needed, and radiation and chemotherapy is needed to control the recurrence of the tumor.